Today's video we'll be talking about endometriosis. What is endometriosis? Well, let's get into it. Endometriosis is a condition that only affects females, and it is often a very painful disorder. It is a disorder which tissues similar to the tissue that lines the uterus grows outside of the uterus. Not normal. The person who came up with this disease was Thomas Cullen all the way back in 1920. However, Thomas Cullen was not the person to give the name to the disease. This would be John A. Sampson. He was the one to name endometriosis. And he came across this 7 years after he completed a paper on ovarian endometriomas. But he first observed the disease when he operated on women at the time of their menstruation. He found that peritoneal lesions were bleeding, proving that the tissue was endometrial origin. He predicted the presence of the endometrial cells outside the uterus was because of tubal regurgitation and diminution of menstrual shedding. So, what causes endometriosis? Well, that today is still unknown. No one really knows what causes endometriosis, which is kind of frustrating. But doctors do, in fact, have a theory. This theory includes a couple different things. First would be retrograde menstruation. Second would be transformation of peritoneal cells. Third, embryonic cell transformation. Fourth, surgical scar transformation. And a fifth theory would be endometrial cell transport, with the last reason, immune disorder. But again, the real reason is unknown. Now, is it contagious? Not to worry. Endometriosis is not contagious. It does not spread from person to person. So you don't have to worry. Unless, of course, you, in fact, have endometriosis. Next, let's talk about some symptoms of endometriosis. There are many, many symptoms and wide variety. So let's get into them. Symptoms for endometriosis can include dysmenorrhea, which means painful menstrual periods. You can have pain with intercourse, pain with bowel movements, or urination. You may have excessive bleeding. Another symptom could be infertility, fatigue, diarrhea, bloating, and or nausea during a menstrual period. So yes, there are lots of those, and those can definitely be uncomfortable and disrupt your daily life. Let's move on to the diagnosis. The diagnosis can be very difficult, but it's not impossible. Why is it difficult? Well, due to the wide variety of symptoms, it can often be commonly confused with other diseases or disorders, including pelvic inflammatory disease, ovarian cysts, or IBS, which is irritable bowel syndrome. Next, let's talk about treatments, because everyone wants to know how you can make whatever you have better and, not as painful and to lessen your symptoms. Well, for endometriosis, that depends. It depends on your level of pain or how many of the symptoms that you have. So if they're mild, a doctor may recommend just over-the-counter meds like Advil or ibuprofen. If they're severe, that may need conservative surgery or hysterectomy. If it's kind of in the middle, a doctor may recommend hormone therapy. Conservative surgery, this is a surgery that will remove the endometriosis growths without disturbing the uterus or the ovaries. This is often the better choice, as it may not do any damage to the uterus or ovaries. On the other hand, a hysterectomy is much more of a change to your body, as it is the surgical removal of the uterus along with the ovaries. This is the most effective way, but it definitely has its risks, and that may include, well, it does include early menopause, as you do not have your uterus or ovaries anymore, and it may include heart and blood vessel disease. So doctors really don't want to jump the gun to a hysterectomy unless it is very necessary. In most cases, endometriosis is not life-threatening, which is a good thing. But doctors do recommend that if you have any of these symptoms, go to your doctor and be open about them, so the doctor may be able to diagnose you. As we have learned, it may be difficult with the wide variety of symptoms that the disease may show within a human body. Back to the treatment plans. Hormone therapy. This may include gonadotropin releasing hormone, hormone contraceptives, including but not limited to birth control, and aromatase inhibitors. Hormone therapy may help with the pain, but it won't cure it, and it's only a temporary fix. Well, that concludes our presentation on endometriosis, so thank you for watching, and I hope you enjoyed!